Signs of Labor and Fetal Movement, a patient education series.
Please note, this program includes general medical information and does not replace the medical advice of your doctor or your prenatal care. If you have any questions pertaining to your medical condition, please ask your doctor or healthcare provider.
I would like to welcome you to our educational prenatal series. The goal of these modules is to help explain certain situations that you may face with your pregnancy. In doing so, it may make it easier for you and your family to understand what to expect. Why learning this information is important. Prior to delivery, you should know how the symptoms of labor may present and why fetal movement is important during pregnancy. After this is explained, it is important to ask any questions to your provider that you may have. This process helps protect your wishes and the health of you and your baby. What is labor? True labor is defined as regular, painful uterine contractions that result in cervical thinning or effacement and widening, dilation. Labor is what allows your cervix to go from closed to open and allows your baby to be born. What should you experience as you get closer to your due date? Lightening, feeling as though the baby has dropped, a change in the shape of your belly. What exactly is happening? Your baby's head is now lower in your pelvis, getting ready for delivery. When will this happen? Usually a few weeks to a few hours before delivery. You may also experience bloody show. This is an increase in vaginal discharge. It may be clear, pink, or slightly bloody, less than a period. What is happening? Your body creates a mucus plug inside your cervix to protect the baby from outside infections. As your cervix dilates, the plug loosens and is released into the vagina. This will happen a few days before delivery or at the start of labor. You may also see some bloody discharge after your doctor examines you. This is normal. You may also experience rupture of membranes or your water breaking. This is a trickle or gush of watery fluid from the vagina that signals rupture. Usually this flow is continuous. A single gush of fluid may only be vaginal discharge or possibly urine. What is happening? The sac of fluid surrounding and protecting your baby has broken. The fluid is called amniotic fluid and it's made mostly of baby urine. This usually happens a few hours before or during labor. Contractions are normal throughout pregnancy. When a regular pattern of strong, painful cramps occur, this may be labor. What is happening? Your uterus is tightening and relaxing to help open the cervix and move the baby through the birth canal. This usually happens at the onset of labor. True labor versus false labor. How can you tell the difference between true labor and false labor? Sometimes it is difficult. The strength and frequency of contractions can usually help to determine true labor versus false labor. First, strength. Contractions in labor tend to get stronger over time. Second, frequency. Time contractions from the start of one to the start of the next for 1 hour. Labor is usually a contraction every 5 minutes or less that gets more painful over time. Timing of contractions. You can use the following comparisons to help determine whether you are in false labor or having Braxton Hicks contractions or if you are in true labor. In false labor, your contractions are irregular versus in true labor where your contractions are regular, every 5 minutes or less. In false labor, your contractions do not get closer together, while in true labor, your contractions do get closer together. False labor typically occurs in the evening or at night. while true labor can occur at any time, and contractions normally last 30 to 70 seconds. Changes with movement. In false labor, contractions stop with movement or change in position. However, in true labor, contractions continue regardless of what you do. Strength of contractions. In false labor, the strength of contractions are usually weak. They may not get stronger, or they may go from strong to weak. In true labor, the strength of contractions increase gradually in strength and become steady. Pain of contractions. In false labor, pain of contractions is typically felt only in the front or in one spot. In true labor, pain starts in the back and moves to the front. So how do you know if you truly are in labor? Remember, to be in labor, the cervix must dilate with the contractions. To determine whether or not this is happening, an exam must be done by your obstetrician. So how do you know when you need to see your doctor? When contractions occur, think 5-1-1. If your contractions are occurring 5 minutes apart, lasting for 1 minute, and occurring for 1 hour, it's time to see your doctor. Other reasons that it is necessary to visit your doctor include vaginal bleeding, when you have bleeding more than a period worth, leakage of fluid, especially if it is green or if it is continuous, and decreased fetal movement. How do you know if your baby is moving enough? You should do daily kick counts. Your baby should be moving 6 to 10 times per hour. If you do not feel your baby move, first, lie down on your side and try to feel your baby move for 1 hour. Relax, the baby is most likely sleeping. You can gently press on your belly to wake the baby. If after this you still feel no movement, then you should call your doctor or go to the hospital. Remember, we are here to help. Recognizing labor and fetal movement is important. If you have any questions about labor, please do not hesitate to speak with your doctor.